Hi, I'm Dr. Sather here in Bellingham. This is my office. I'd like to give you a little tour of the place. Why don't you come on in and we'll fill you in on what's here, okay? Hi. This is our reception area. My front desk person sits right here. Okay. Magazines over there for you to look at. Now, come on down here. We'll go through. I have treatment room number 1, and this is where we do our adjusting, and treatment room number 2. I use tables that help people make it easier to get from standing to laying down. Sometimes people hurt a lot, so these are kind of effective at helping that. Sometimes people can't, patients can't always do that too easily, so this makes it really nice and easy. So, my office, and of course the back hallway, right down there. This is where we do our adjusting. Take care of people, help them get better and feel better too. If you have any questions, you're more and you could say they're in Bellingham, Washington, and I'm here to give you a little description of what happens to people and how they get low back pain. So, this is the spine. We all have one. A lot of times we don't take very good care of it, and we can cause problems with it and have pain occur if these joints here get damaged in some way, and these joints here. Okay. These are called our sacroiliac joints, and these are just the interlocking joints of the spine. Lower back pain can be caused by either of these sources, right here and here, and these up here. You can also have problems with the rest of the spine as well, but typically what we do is we adjust these areas and get them moving properly once again, and you begin to recover, and it will have the back pain go away. As we adjust, you keep and take care of you. So that's a little bit of what we do here at Sather Chiropractic Center, and I'd be delighted to have you come in and show you around, give you a little tour if you like, and help you with the problems that you may have. So the phone number here is 360-650-9550. Okay, give us a call. Hi, I'm Dr. Sather from Sather Chiropractic Center up here in Bellingham, Washington. And I thought I'd spend just a moment or two going over a couple terms so that you can understand what we're talking about when we talk to you about your spine. The spine is a movable, flexible, segmented structure. That gives it its mobility. It also gives it its problems. So, we use a term called subluxation, which means nothing more than a bony misalignment of 2 or more of these bones, and that's it. And in here, these are the discs. They act like shock absorbers. And so, what can happen with motion and movement and/or traumatic events is that these things can get slightly out of position in alignment with the others that are above and below it. And it'll create problems for you. It makes it hard to bend over sometimes, and it'll irritate these little interlocking joints. And that'll give you the localized pain at the various levels that the problem exists in your spine or backbone. So, it'll also have the potential of irritating all the nerves that come out at all levels of the spine. They come out starting way up in the neck, go all the way down to your sacrum, your tailbone, and these go down the legs, and there's some here that go down the arms. So, with spinal misalignments or subluxations, it can impinge on these as they exit the spine and cause you problems. You can get pains, aches, numb and tingly sensations, lack of ability to work your hands or your feet. And so we come, as a chiropractor, we come in and we adjust these areas and get the motion returned to those areas that are being troublesome and relieve the tension on the nerves and thereby handle the problems with the hands or the feet or even up in the neck and all the way up in the head. So Just thought I'd spend a few moments with you and go over what can happen when we get misalignments or subluxations of the spine. Thank you very much, and I look forward to hearing from you. The phone number here at Sather Chiropractic Center is 650-9550. Hi, I'm Dr. Sather from Sather Chiropractic Center up here in Bellingham, Washington. So I thought I'd spend just a brief period of time here and tell you a little bit about troubles that can occur with your numb and tingly hands, pins and needles, that are a product of irritation and damage to the nerves as they exit the spine. You'll note here that you have nerves, which are the light yellow, that travel all the way down, come out of the spine, travel all the way down the arm, and also all the way down the leg from the spine. What can happen is you can get irritation of the nerve as it exits the spine right here, and you'll feel it down here in your fingers as numb and tinglies or pin pricks sensation, prickly sensation, kind of a cottony sensation or a heavy, thick sensation. But you might think it originates here, but it actually occurs here as it exits the spine, as the nerves come out of the spine. The same thing is true down here. You'll have the same sort of feelings in your lower legs or your feet, and or burning and achy sensation that travels right down here, and this is known as your sciatic nerve. So people say they have sciatica, and it comes from back up in here. There's a problem when the nerves come out of the spine and go down the leg on either side, and you'll get a sensation of numb and tingly, pins and needles, prickly sensation, or sort of a thick, heavy sensation, kind of a cottony sensation. And that is handled by chiropractic adjusting. We get these areas of the spine taken care of, and the irritation to the nerve goes away, and so does the sensation that you're experiencing. Thought I'd just spend a minute with you and go over what it is that creates numb and tinglies. Okay? Thank you very much. Hi, I'm Dr. Sather up in Bellingham, Washington, here at Sather Chiropractic Center, and I'd like to give you a little brief explanation of what osteoporosis is and how it affects the spine. Okay, so what you have here is a little demonstration. This particular vertebra, or bony part of the spine, is in very good shape. There isn't any osteoporosis here. This is goes down to the next one, and you'll see that there's a lot more space in here than there is up here. This is nicely filled in. And as we go down further, you'll note that there's more space and less bone. So as osteoporosis continues to occur, you have less and less support inside the bone, actually, and it tends to begin to compress. And this is how, and this is why, there's such a problem with osteoporosis. We want to see healthy bone here, and as you deteriorate, you get actually a narrowing in this space, and you'll notice that also over here there's a decrease here, and the bony structure becomes weakened as a result. So there are some nutritional things that we can do to assist in sort of repairing to a degree the problems that exist here, and sort of head you back up the ladder instead of continuing on down. I just thought I'd spend a moment and go over that briefly with you. Okay? Thank you very much. Would love to hear from you. And so give us a call, 650-9550, here at Sather Chiropractic Center. Hi, I'm Dr. Sather in Bellingham, Washington, at Sather Chiropractic Center here. I'd like to go over briefly what can cause headaches with people and see if we can't give you a little information here. So you'll note that there's a lot of muscles that start down in the lower or the upper part of the back here that travel all the way up into the neck and up into the head. So what will happen is when you, get misalignments of the bony parts of the spine down in the upper part of the back and the neck, you will get a corresponding contraction of the muscles around those to help protect it. So those muscles travel all the way up into here, and it puts an extra strain on the actual skull and the head, and those will give you tension headaches as a result. So the way to handle that is to get the function of the upper part of the spine and the neck to work properly, and then you'll have the tension in the muscles back off and the tension in the skull, and your headaches will dissipate to a degree. Go away sometimes with the first visit. So just thought I would let you know today that there is a solution for headaches, and we'd love to take care of you. So give us a call. 650-9550 is the number. Look forward to hearing from you, okay? Thanks.